He'll be talking about the trash to treasure Retcam and ASPI Gonio. So Dr. Shishir is a consultant vitreoretinal surgeon in eye microsurgery and laser center in Tiruvalla. He has done his former MS ophthalmology in Vellore, and he's been a VRS fellow in Arvind Eye Hospital, Coimbatore. He has keen interest in publishing articles, and he has more than 20 to 30 published articles in his name in peer-reviewed PubMed Index journals. I'd like to invite him to give his talk. This one only. Yeah. Thank you, everybody.
Yeah, great talk, Prithvi. So I'll be just expanding the same use of smartphone into other forms of imaging. So no financial interest again. So we know that the smartphone, there's been a big revolution, and it's been used for almost all types of ocular imaging, right from the anterior to the posterior segment. And this is like probably will be the new way to go about it. So I'll expand the use of the ASPI, what Prithvi just described, to gonio imaging also. So we know glaucoma, most second common cause of blindness, with large population in India being affected from it. And we have open angle glaucoma being same as narrow angle disease, which is equally prevalent in India. So when you make a diagnosis of open angle glaucoma, how do you need to do a gonioscopy to actually see that the angles are open, following which only you can make a diagnosis of open angle glaucoma. So visualizing the anterior chamber angle is very integral for the screening. So the previous imaging techniques have been taken utilizing the slit lamp. So smartphone has been described for gonio imaging. So where two previous small innovative techniques were published in the Journal of Glaucoma, utilizing the smartphone, but they were an unaided technique. They did not use any macro lens. And the patient needed to be in a supine position to kind of get these images. So this first image here, which shows that the patient is in supine position, and using a gonio mirror, you just directly use a smartphone and click the angle images, and you could get a little bit of a wide field view, but not a very clear view to actually grade or image the angle very clearly. The other technique utilized an iPhone 11 Pro Max, and then utilizing that, you could get good images of the angle, and along with that, you could, if there was a second observer with a retinoscope, you can throw a slit light and you can even get slit images of the angle. You could actually grade it also. So Prithvi has already described the ASPI, and so the aim of expanding the use of ASPI to gonioscope was to take low cost device to take pictures of the anterior chamber angle using an IOL, and also to highlight that the intraocular lens can be used as a macro lens. So the material required, again, ASPI, then you definitely require gonio mirrors. Use slit lamp and retinoscope are optional. That's only if you want to take slit images. You, however, require IOL powers of 6 diopter, 8 diopter, or 10 diopter. You cannot take more power of IOL, like what Prithvi described for his ASPI. 15 or 20, you cannot take it because you cannot take images with that. You need either 6D, 8D, or 10D. IOLs. And obviously gonio mirror, anyone will do. A contact technique like a 2-mirror gonio mirror is slightly better, but if you also have a 4-mirror or a 6-mirror, you can take images with these. So methodology, we actually did gonio imaging on 33 eyes of 20 patients, and it was a routine slit lamp examination followed with putting topical anesthesia, checking the intraocular pressure, and then you can place the gonio mirror and you can image them using the ASPI. So you can do it either in the sitting position with the chin of the patient on the slit lamp, or you can, even if the slit lamp is not there, when you go for your glaucoma screening, or they send you for screening camps, before you want to dilate the patient, you can just make them sit, and then you can put the gonio mirror and you can image the angle. Or if you can even do it in the supine position. So how to acquire the image? So the phone needs to be on, with the flash should be on, and it should be on the video mode. And then if you utilizing a 6 diopter IOL, you can take a good image with, and the distance between the gonio mirror and the IOL is quite significant. So you don't need to go very close with the phone, but if you're using a higher power IOL like 8D or 10D, then you need to go really close to the gonio mirror to acquire a good and a clear image. So these are some of the images which we obtained using, the first image is with the 6 diopter, the second image with the 8 diopter, and the final image is with the 10 diopter. So little more wider field of view with the 6 diopter and a little more close-up view with the 10 diopter. And you can get these different images with the single mirror lens, a dual mirror lens, or a 4 mirror lens. These are the images which you get. So a contact technique slightly more better than the 4 mirror lens. So these are some of the other images which we got, and then it can be magnified because of the zoom of the phone. So if you get even a wider picture, you can magnify it and see the angle structures very, very clearly. So this second image is that of a post-trabeculectomy patient. You can see the ostium and also the PI which is being made, and get it very clearly with the gonio. And this final picture is that of silicone oil, emulsified silicone oil in the superior angle. We could even get slit images. The only thing with slit images is you need a second observer. So, or you have to do it on a slit lamp. So placing the gonio mirror and then putting the ASPE, getting the image, and then you need a second observer to kind of throw a retinoscopic reflex light onto the gonio mirror so that you can get a slit image of the angle. So here grading of your angle can also be done using this technique. So the advantages, it's good resolution, any gonio mirror can be used, it's quick, inexpensive screening tool, utilized especially in secondary centers or in peripheral centers or during your CAM screening, and it's good for resident training and education. You can send for a second opinion, whether to a senior person to see the angles. So few limitations, a small learning curve for beginners, when you move your smartphone, and you cannot use an IOL of more than 10 diopters. So, and sometimes not everybody has a iPhone with a peripheral camera. Some of them will have a central camera. So then your maneuverability is a little difficult because it's obstructed by the nasal bridge of the patient. So a little difficulty with the a central camera, but if you have a peripheral camera, it's good. If you put a 6 diopter lens in a phone with a central camera, then the problem is sorted out. So you really need to have a 6 diopter IOL to get like good and wide field images. So I'll go on to the next one, which is the trash to treasure Retcam. So now we know that we have a lot of devices for fundus imaging. So we have the fundus cameras, mydriatic and non-mydriatic. We have the handheld fundus cameras manufactured by different companies. And we also, now we have smartphone based fundus imaging. So initially, smartphone-based fundus imaging was described by Lord, and he used the video mode of the phone to continuously image the posterior segment, and then he used to extract frames from it. So it's particularly useful in low and middle income countries where you cannot really buy high-cost posterior segment imaging camera. So now smartphone-based imaging is more advanced now, and there are specific softwares available to improve the quality of the image. So what is the principle? The principle is same like an indirect ophthalmoscopy. Here, instead of your eye, it's being replaced by a smartphone. So using that same principle, your smartphone captures the image in video mode or in photo mode, and then you can visualize it later. So a lot of my colleagues, they have been doing this smartphone based imaging, but however they are not utilizing any adapters, or they're directly putting the 20D lens and then using the smartphone in their hand, they're trying to capture the video. So a lot of them are doing because they don't have the imaging devices, and some of them are even visiting secondary and peripheral centers where they're utilizing this sort of a technique to get images. So we have now smartphone made Retcams available. So this first one was the DY Retcam by Dr. Biju Raju and John Davis and group. So they developed that, but it was a little complex, and it did not require a slit lamp to use, whereas the commercially available ones, the Me Retcam by Dr. Ashish Sharma and the JS by Dr. Jayatra, They're commercially available, and it's a slit lamp based adapter you have to use to image. The other ones by different companies, Welch-Allyn, they have one which gives you a 25-degree field of view. There is one by DI, that is 200-degree field of view. And then there is another one by Peak Retina, which will give you approximately 40 to 50-degree field of view. The VOC also has developed one, which will give you around 45 to 56-degree field of view. So, but for that you require an iPhone SE or an iPhone 5, which is compatible with their camera. The device, and then using that you can get pretty good images. They also have their app, the VOC InView app. So if you that will help you click pictures by once you automatically focus, the device will automatically click the picture with the help of the app. So Dr. John Davis has developed one using 3D printing technology. He has developed one which is called the John Das Pocket Foldable Fundoscope. So using this, it's a pocket thing and 3D printed. You can unfold it, put in your 20D lens, and then you can get good images of the smartphone. It's patent pending, and I think it's 800 for one. So it's a low cost, ultra portable camera, and it acts as a case for the 20D lens also. So the next, what Prithvi has developed is the T3 Retcam, the trash to treasure Retcam, which is a simple, affordable, do it yourself, and it's wireless. So this is a very small video on how to make it. You need a sanitizer bottle which is used, and then you can cut out using a scalpel a holder to place your 20D lens. Yeah, so once you have removed the tip, you can just fold in the edges, and then you can put your 20D lens. Yeah, so now it's technically ready to use. You can put the adapter it's available on Amazon. That's a universal smartphone adapter. You can just attach it and then attach your phone to it, and then you can put a black paper to prevent the reflection of light. So then now this device is ready. The smartphone adapter is available in Amazon for 490 rupees. This is the link. And so again, the principle is the same, acts like your indirect ophthalmoscopy. Only thing, instead of your eye, it's now your smartphone which is going to take the images. So how to acquire the image? Video mode of this with flash on, and then dilatation in a dark room preferred, supine or sitting position. You support the device with one hand with the index finger, and with the other hand you have to open the pupil. Open the lids of the patient so that you can get a good, with the dilated pupil, and get a good image using your smartphone. So peripheral images you can get when you ask them to look up and down, right or left, and the image what is recorded on the smartphone will be like how you see, inverted and laterally reversed. So multiple apps are available like the Hope Scope and the Alman indirect app, which will help you remove the artifacts and re-invert these images. So this is the T3R in action, specifically useful for DR screening in multiple peripheral centers, and even for ROP it has been used, and you can get pretty good and clear images of the posterior segment. So there's a small learning curve, and the smartphone flash should be coaxial with the camera, otherwise you won't get a good images. And the magnification depends on the type of lens used. So if you're using a 20D lens, it will be 56 degrees, and that's ideally the best lens, because if you use 2.2 or 22 diopter, then you have more of reflexes coming in. So this has been used for the diabetic screening and found to be quite sensitive and 100% specific. So again, when you use for DR screening, and you can get pretty good images, and you can almost diagnose the disease there itself during the screening. So smartphone has definitely revolutionized, and smartphone fundoscopy, it has been used for diabetic retinopathy, ROP, glaucoma, even in pediatrics, for teaching definitely, and even for during emergency medicine. When you're called to the emergency to see for papilledema, you can use this T3R Retcam, or you can use the smartphone based fundus imaging. So the advantages, both photos and videos could be obtained, and you don't need an expert person to utilize it. So improves the cost effectiveness of screening, and is affordable, portable, and for telemedicine and teaching. In ICUs, could be used for patients who are supine and you want to see the fundus, can definitely be used. So small disadvantages, small learning curve for beginners. Again, there can be slight glare, and if you have cataract and media glare, then obviously the image quality won't be so good. So there has always been a question of smartphone light safety. So ISO has graded the safety profile for these ophthalmic instruments. So they say that 1 minute retinal exposure is for these current smartphones, they don't cause any thermal or any photochemical damage. But now we have latest models of phones coming up which are 20 times more power. So these should be analyzed before you actually use it for retinal imaging. So to conclude, it's ASPI-GONIO, very effective for screening, imaging and documentation. You can grade and image the anterior chamber angle. And for fundus imaging, the T3R is a frugal and easy do-it-yourself smartphone imaging technique. And the risk for photo damage using the current phones and current flashlights is extremely less. Another advantage of smartphone, you can get a lot of literature out of it. So thank you.
No, you finish this.
Finish that. Yeah. Okay. So I have one more small, very small talk. You can put on the thing. Yeah. Okay. So smartphone assisted refraction, particularly useful for those who are learning refraction, beginners, first year residents, and even for optometry students. So again, no financial interest. So retinoscopy is quite an objective refraction technique, and it's very important for assessing refractive errors, especially for children and even adults, for prescribing a good power of the spectacles. And we do have excellent literature and animated videos available for the refraction, but when you teach, you simultaneously cannot observe the reflex, and even the observer or the mentor cannot really tell what type of a reflex you have obtained. You cannot observe it simultaneously. So that's the problem with the refraction. When you teach, you observe some reflex, but when you tell, they may feel that it's different. So in the previous techniques have been used where they use a teaching attachment onto the retinoscopy. So this was one by Welch Allen, where they utilized another tube, attached it to the retinoscopy, and then one observer will see through the pinhole and the other observer will see through the side scope. So this is another one where they put in a camera, connected it to a TV, and then you could observe the reflexes directly on the television. The Hine have developed a prototype video retinoscope where you use that to get the retinoscopic reflexes from the patient, and whatever the reflex you get is imaged onto the screen there. So learning and teaching is better when both the mentor and observer are able to see and appreciate the retinoscopic reflex. So we describe this technique, the gimbal scope. So what is gimbal? It's any device for keeping an instrument such as a compass horizontally in a moving vessel or aircraft. So that was the word gimbal which we got from, and it's commercially available on Amazon, this gimbal, for basically imaging cameras or even smartphones. So we developed the gimbal scope utilizing the smartphone adapter, the retinoscope, and then attaching the adapter onto the retinoscope, we could directly do a retinoscopy. So here again, the principle is the same. Instead of your eye, the smartphone is the one which is capturing the reflexes. So this, once you do it on patients, the retinoscope reflex could be observed by the mentor as well as a trainee student or the optometrist who's standing along with you, and they could both appreciate the reflexes when you use a smartphone, because the smartphone is the one which is going to record these reflexes. So the advantage is easy assembly, clear retinoscopic reflexes, and this is a zoom tool for magnification. It's better understanding of phenomenon by these beginners. So video recording is important, can appreciate the reflexes and see it later, and it's a convenient, inexpensive tool. So it's a teaching tool for medical students, residents, and optometrists, and can be used in primary or secondary centers. Yeah. Okay, thank you.